For sure. So I'm Dr. Duclas Charles. I'm a pharmacist from Brooklyn, New York, first generation Haitian American, and I'm the founder of Paradigm Health. We are a marketing and strategy agency that sits at the intersection of community, culture, and healthcare, and the team and the engine behind Black Health Connect is one of the largest intergenerational, interdisciplinary networks of healthcare professionals within the healthcare ecosystem, bringing together clinicians, folks from the policy side, pharma, health tech, entrepreneurs, C-suite individuals, all into one space in the community.
Sure. Good. Thank you. Thank you. That's a very sharp introduction. Thank you for being here. Please, if you're here, let us know you're here. Put your comments in the section that we have here. Let us know where you're joining us from, and if you have questions for our guests, please also put in the comment section. First question, your name. The first thing that got me attracted is your name, Duclas. What does that mean?
Yeah, so my name is Duclas. It's actually my great-grandfather's name, so I'm named after my mom's grandfather. Always asked that question when I was growing up. What I've been told is that it means the king is here. So, and I think for me, it's for always been a part of me striving towards leadership and building community, right, and being somebody that's within community, other people, for the people. So, but yeah, that's the name of my name.
Duclas. That's what you call it, Duclas, right?
Yeah, Duclas. Yep.
Thank you. Yeah, Dr. Duclas. Thank you for being here. That's very nice. Thank you for sharing that. We have Alicia Moore here. Thank you for saying hello. Thank you for Velma is also here. Thank you for being here. Kamika, a lot of people are here. Just not for me, just for you. You're the special one for today. Thank you so much for being here. I was really inspired by your story. I read that you discovered your passion for science and community impact as a student when you were at the Brooklyn Technical High School. How did you come about this? How did you know that you're passionate about science and community?
I think I've always been interested in tech, science, and marketing as well since I was a kid. I was doing graphic design in junior high school, working on coding at home. When I got to Brooklyn Tech is a technical high school here in New York City. We ended up having majors. So you could be like a media major and do graphic design. You could do biochem, you could do chemistry. So I was a chemistry major in high school, loved it, led the forensics team. We won competitions in the city. And then through that, when I was figuring out what I wanted to do in college, decided on pharmacy. My uncle's a pharmacist. I'm big on entrepreneurship, and I think I already knew I wanted to be an entrepreneur from then. And he owned his own pharmacy in New Jersey. And I feel like that was the path that would allow me to, get a degree, have a stable opportunity in a job, but also have the opportunity to build a business if that was the route that I wanted to go.
Wow. Thank you for sharing that. So family inspired you, environment inspired you. That's very good. Thank you for sharing that. So you wrote something on your shirt. You have community is the center of change. Yeah. And that makes a lot of sense because you started an organization which we all know, a lot of people know about. I knew a long time ago, Black Health Connect. Why yes. And how did you start this organization?
The why, I think, evolved, to be honest. I think Black Health Connect has become a vehicle and a network to solve the isolation problem that we have like in healthcare. I think a lot of us come from different backgrounds. We go to school, and depending on where you went to school, you might have been the only person that looked like you in your class, right? And you get to the workforce, we talk about diversity in healthcare, and you don't see a lot of people that look like you. But, to be honest, originally it was just a way for me to bring my two worlds together. Always loved bringing people together. When I was in high school, we loved playing like convenience. My friends and I, when I got to college, was also always doing the same thing. When I moved back to New York, we're still doing things like bringing together networks of professionals within the city. And then one day I said, like, let me do this for healthcare. I'm in healthcare, let me do something specifically for healthcare. Our first event was about 50 people. Didn't think much of it. And then when folks started giving me feedback, I recognized that it was truly a valuable space, even though it was a smaller event. And it also made me realize that the opportunity that I had going to Howard University was a very unique one. Howard University produces, from what I remember, the most Black doctors in the country. We have a medical school on campus. We have a full allied health program, so nursing, PT, PA, laboratory sciences, dental school, medical school, law school, MBA program. So through that transition through university, I was able to really build a strong network of folks that were in my industry that I stayed connected to even after I graduated. So even though I was one of the few pharmacists at my location that had a background like mine, I still knew I could call 5, 6 other pharmacists in the country that could relate to me, that could give me feedback, that wanted to support. But my friends who stayed in New York, who went to PWIs, who went to Ivy League schools, they may not have had that same opportunity. So me creating space at one time was great for them. People met each other that worked at the same hospitals, same companies, but never knew that they existed. So we started doing them quarterly in New York. We went from 50 people to the end of that year, 500 people, and then grew to over about 1,000 people per mixer. And then after the pandemic, we started traveling city to city. So now we have communities in a little bit over 25 markets. We're all across the U.S., but we're also in 4 countries, 3 continents. So we're in Ghana and Accra, and Nairobi in Kenya. Shout out to the BAC Africa team, and then also in Europe and London and the UK. So through that, just understanding, and that's what's on my shirt. I always say community is the center of all change, right? How do all of us come together from these different verticals in healthcare, from the different places in the ecosystem, and just learn from each other, have ideas, build with one another. People may want to transfer, go to different roles in corporate. People may want to build solutions and they have their subject matter expertise, but need somebody else to help. Us creating this space, this network is a catalyst to a lot of different things happening. And I love that. I've always loved that about bringing people together.
Good. Thank you for sharing that, bringing people together. Thank you for joining, Casey. Miami on Instagram, and also Kamika, thank you for joining. You just highlighted the growth that happened just by you seeing the need for something, bringing people together after work and things like that. But then it's more than that. You actually have a conference that takes place every year, the BHC conference, the BHC Foundation 40 Under 40, that's very popular, digital community engagement. Any story that inspire you the most from any of these programs that you always look back and say, whenever you want to give up, you're like, yeah, I have to keep doing this because of this particular thing?
No, yeah, I think, thank you for calling that out. We have been able to do a lot. After our first BHC mixer in Accra, what happened to me there, I was truly inspired. We had community members from London, from Germany, from Amsterdam, meeting people from DC, from Florida, from New York. And I was like, wow, we had to go all the way to another continent to bring all these people from different cities together. And that's when the idea sparked of, all right, well, if we're already bringing people together, we can get people to come to Ghana together and get people to come together in their cities. Why are we not bringing all the different cities in the US together? So that's when we set out to do our first conference. And we launched the Bridging Healthcare Communities Conference about 3 years ago, BHCCon. In DC, again, shout out to Howard University, right? That's the inspiration for everything in the background. So we had to be there. And in 2023 was 2020, wow. Yeah, 2023 was our first conference. Had about 252 people from 26 different states, 20 different professions in healthcare. And we were able to do what we felt like was what was needed in the space, highlighting entrepreneurship, highlighting leadership, highlighting the changes in policy, right? Highlighting also what was coming clinically, at the forefront. What's innovation in healthcare look like, but from a lens that was cohesive of the entire ecosystem. And even that since then has grown. Last year's conference, we had close to 600 people in attendance, almost 35 different professions in healthcare present. And almost somebody from almost every different state in the country. So it's been a great inspiration. I think a lot has come out of it. I've had people get jobs from different companies and sponsors that were in the room. I've had people that meet each other and have become business partners and built businesses from being in the space, or found investment opportunity. And it's all those things that like I truly enjoy being the catalyst for. When somebody says, oh wow, I just got a fellowship to this program from somebody I met in a whole other state, right? Because they were at your conference. That was amazing. Or the other thing that we're super passionate about is supporting our entire ecosystem. So like you and I, we met at a Young Black Farmer conference or a meetup. One of the organizations I truly love, the National Medical Association, National Dental Association, and NAHSC, all these organizations that support the different areas of the ecosystem. People get to discover those organizations too when they're in our network, because we try to pull them in as much as we can. So folks coming to a BHC event and then learning about Young Black Pharma and like, wow, this is a space for me because I'm in pharma. Or learning about pills, like this is a space for me, I'm a pharmacist. Or NPHA, right, I'm a pharmacist, this is a space for me. So those are all things that have been amazing. Black Health Connect 40 under 40 is also a great thing. I think I've always watched the different lists pop up, creators of the year, Forbes 40 under 40. I think healthcare typically gets overlooked, even though we're at the center of so many different things. So instead of waiting for somebody to make up a category for us, why don't we just do it ourselves? Why don't we highlight the people that might be getting overlooked in their environments, right, in their spaces, highlight the people who are doing amazing work, bring them together. They might be resources to each other. So we've had 2023, 2024, 2025. We've had 3 classes of 40 under 40. This year is going to be our 4th 40 under 40 class, and next year will be year 5. So super excited about that. Applications for 40 under 40 are going to open up next week. So I'm looking forward to seeing where that goes. And that 40 under 40 led to the development of our foundation. So the idea is, we can do good, right? We can do well and do good. We can have an impact. How do we mobilize the community that we're building? So on the nonprofit side, with the BHC Foundation, 40 under 40 awards, our gala is like a fundraiser for that. But all of our impact work fits there. So last year, the 40 under 40 gala helped to raise money for our BHC licensing scholarship. So we were able to give out $15,000 to 30 new graduates across different disciplines: social work, nursing, medicine, PT, pharmacy, dentistry, so they could pay for their licensing exams. We also do a community health fair annually in Accra. We just did one alongside the Afro Future Foundation in Accra this year for our 3rd edition of that. But then we also do a community health fair in partnership with the Decision Project in DC alongside our conference. Right, we talk about access to healthcare and health impact. And sometimes we always think about countries externally that need support, but some cities we live in, there's environments where our communities need that support as well. So why not mobilize these networks that we've been building to have impact to give back? And that's some of the work that the foundation is doing. Super proud of what we've done so far, and excited for where we want to go in the future.
Wow, that's a lot of work, right? I see why you're very busy. I want to quickly say I'm part of your success story, because I get to know Young Black Pharma when I came to Black Health Connect conference. Actually.
Nice. Oh wow, that's amazing. That's amazing. Yeah. And those are the stories you want to hear. I think the difference between BHC is that a lot of our organizations that have existed in silos, right? And even as a community, the joke I used to make is we tend to do that ourselves sometimes culturally, like the West Indians over here, maybe Black Americans over here at times. But it's like those silos are what keep us from coming together and thinking about things. So my goal would be like, how do we bring everybody together? How do we bring the ecosystem together? Health tech, bioengineers, what have you. So it's great to hear that you're able to find your home, find your
Yeah.
core group while attending BHC. And I think it's an opportunity for us to continue to partner with those networks so everybody grows together.
Good, good. Thank you, thank you. Talking about bringing people together and opportunities, you just got an invitation here from Ali Shamar. We would love to have Dr. Charles to be a guest speaker for our non-profit organization. And so please, Ali Shamar, reach out to him. That's how connections happen. That's thank you for joining. And also we have another person joining, Mo Iyanda on Instagram. Thank you for joining. It's been a very great conversation going on. I will also have somebody from Nigeria. Thank you for joining. It's a very good conversation going on here. So you said you've done a lot of things, and really appreciate a lot of it. I've been part of already, but I also know that you have the Paradigm Health that you started after BHC Connect started.
Yeah.
So what led to that? What was the transition to that?
I think it's just more so evolution. BHC is like our community that we've developed, but when you think about all the pieces that it takes to run the community, grow the community, the company doing that is Paradigm Health. So about when and we're able to also do those same things for our partners, right? So whether we're helping to market conferences for other organizations in our ecosystem, or even executing on strategy and marketing or community engagement events for pharma partners, hospital partners, things of that nature, it was really creating an infrastructure around this is the engine that can help to create these things. So it's technically always existed, but now something that we want to make sure we bring to the forefront, right? So without Paradigm Health, there wouldn't be a Black Health Connect, right?
Yeah.
And what we want to partner with companies or organizations, we're really going to be partnering with Paradigm Health. BHC is the community that we are going to continue to invest in and pour in to see grow, where we can still partner with different organizations through the Paradigm Health as an agency and as an organization.
Good, good. Thank you for sharing that. So I also noticed that you are interested in healthcare, equity, and innovation.
Yeah.
If you want to think about how these three things come to align with each other, how has that shaped what you do? Do you think about those three things when you do things, or do you think one of them comes first before the other? How do you combine these three things?
I think innovation without equity creates new gaps, right? And then equity without innovation moves too slowly, right? So it's just like those things all need to come together. And honestly, equity, when we talk about innovation, right, I think it happens much faster, or it occurs much more slowly in silos. So the whole idea of bringing everybody together so we can innovate and change and create more equitable systems in healthcare is like it's all interconnected. It's every time we do one thing, it helps to lead into the other. So when we're building this network, we're designing systems where progress actually reaches the people who need it the most, right? And not just people who can afford it first. That's the goal. Like we want to design systems and create opportunities for people to design systems to make everything more accessible. And I know there are a lot of people that want to do that each other at times. So building these networks way to fast track that innovation to help lead to better equity. And that's like our thought process with the community that we're building.
Wow, thank you so much. You just mentioned something now, bringing things that people need to them, not just the people that need it the most. Some people need it, but they don't have access to it. And that's why you probably do the community outreach programs, the annual community health fair, and the high school checkover. I saw that you did that. If you want to look back to one of these things, or a couple of them that you've done, what would you see excites you the most about the community fair and also the high school checkover?
Yeah, I think the community health fairs are great. Really, just like being able to mobilize the community that we've been able to engage, right? Whether it's the community health fair during the conference, where we have 600 attendees coming into DC And then now, boom, the clinicians, the administrators, anybody who wants to get involved will volunteer and support that conference and really just give back to the community that we're all convening in. Same thing with our community health fair in our crowd alongside Out for the Future. We have a great team out there led by Dr. Rashad Abdullah. We were able to really just give back to the people in our crowd, but also like learn from them, understand culture, right? Healthcare is such a human thing. So the culturally competent aspect of it is extremely important. So seeing volunteers from the States and from Europe working alongside professionals from Ghana and from Accra has been great because we all can learn from each other and rub off from each other. I think it's like the ability to mobilize folks, give back, and then still build community while you're doing it. BHC High School Takeover, which is one of the like smaller initiatives that we're like piloting within the foundation, honestly was again same thing. How do we mobilize this network to then go back and inspire the next generation? So a few years ago, we were able to take 12 members of the BHC New York community, go into a high school for health sciences, and just really talk to them about career pathways. And we had a pharmacist, we had an orthopedic surgeon, a VP of a VP for one of the largest health systems in New York State, their nurse, right? Somebody on their own health tech startup, and is talking to these different students about these are the ways that you can go. And for our network and our organization to be a vehicle for that is amazing. It's exciting to see what we can do, right? It's just how do we get access to resources, how do we get access to more partners so we could do this type of work more often.
Wow, interesting. You guys went to Ghana, but you guys didn't come to Nigeria.
Oh yeah, we're working on it. We're working on it for sure. We have a ton of friends from Nigeria. We're planning some things out. It's slow and steady right now.
Yeah, good.
As much as we can.
Yeah, thank you for sharing that. So another aspect of that is also the networking, the mixer, the happy hour, which I've been part of. I've attended a few of them, but then what is usually the most exciting thing apart from the music? The music is good. I know Black people like music and things like that. So if you want to look at it in the lens of that, what do you think people look out for? What do you think they really get people excited about this music?
It's just like being in an inclusive and safe space. I think that's the most exciting piece, I think we all have networking opportunities within any industry that we work in. Sometimes we go to them and we feel like, I have to maintain a certain posture or the way that I'm speaking or things of that nature. And in the spaces that we've been able to connect with the Bridging Healthcare Community Mixers is like, this is a space that it's a safe space. Obviously we're maintaining professionalism at all times. We're being our professional selves, but then you get to be yourself. You get to connect over the song that might be playing that your mom used to play at times or used to listen to in college, but then also you can talk about the experience that you're having in the workplace that somebody else might be able to align with. And I think a lot of people, they live in spaces of isolation a lot of the time, and then our mixers that one time a quarter maybe, or one of the few times a month that they feel like they're in this inclusive space and they're not the only one. I think that's the most powerful piece. I know every time I go to a mixer, I get rejuvenated, I get excited, I see people connecting, right? I'm meeting other people doing amazing things, inspiring things. And I've heard that from a lot of our attendees. There are a few folks who have been to multiple events in multiple cities. Like they live traveling distance. I'll go to Atlanta, I'll go to Charlotte, and I'll see them in Miami. It's like, wow, where do you live? But they just really love the community that's being grown. So truly passionate about that.
Yeah, good. Thank you for sharing that. I can personally say my network has improved and expanded based on attending this event and talking to people, getting to know people and things like that. That's for sure. Thank you for sharing that. So we want to shift gears a little bit into another conversation, something that I knew that you were interested in based on your bio, medical cannabis.
Mm-hmm.
How did you know about that? You're interested in?
That's definitely an interesting story. So I'm a pharmacist by training. I went to Howard University for undergrad and for my doctorate in pharmacy degree. I did the 6-year doctorate program, so I was there from 2008 to 2014. Graduated in 2014, moved back to New York. I've done a little bit of everything in pharmacy, to be honest. Pharma is like the one thing I haven't done just yet, but I think this is my pathway to it, to be honest. So I was at CVS for a little bit, community pharmacy. Then I did health system management for a little bit. I was a supervisor at a hospital, moved to a tech startup. And then when I was at the tech startup for a few months, another pharmacist in the organization I'm in a pharmacy fraternity called Kappa Psi. They were leading the same organization around the same time as me to be the pharmacist in charge at a medical dispensary. So what's unique is that in New York, medical cannabis, the way that the law is structured, every medical dispensary requires a pharmacist to be on site and on staff. In the majority of those locations, the store manager, the pharmacy manager is who's leading the entire operation. And it's because we understand that cannabis is a medicine and it's truly like creating a clinical environment. The other states that are like that are Connecticut, New York, Louisiana, Arkansas, Pennsylvania, Ohio, and Virginia. So those are all states that there's a clinician or specifically a pharmacist involved. Maryland requires like a clinical director. So the pharmacists that work at the enterprise level organizations in Maryland as well on the medical side, the clinicians. But for me, it just that was the thing that clicked. I've always been into integrative medicine. When I was at Howard, I took the natural medicine elective, right? All of the pharmaceutical products, I mean, not all, but a lot of pharmaceutical products that we utilize are based on some type of natural product that they were originally discovered from. I think culturally, we've always had natural medicines included in how we take care of our health, whether it's a tea your grandmother would make, etc. But I think there's a beauty in understanding the science of it. And then for me, with medical cannabis, was also understanding there was a lot of misinformation about cannabis that was out there too. So the science of it was a way to decriminalize, right, destigmatize the plant, and also destigmatize the people that were associated with utilizing it, especially if they were utilizing it and didn't recognize it. So got into it, got into the science, really loved it, learned about the endocannabinoid system, a system that's a part of our nervous system that has been discovered in 1990, but we still don't learn about it in schools, right? The only people who really talk about it or learn about it are PhDs in like neurology and folks who are really in that space and experts in science of the brain and the nervous system. But integrated systems in our body that helps us maintain balance and homeostasis, right? The body produces cannabinoids of its own, but then with this plant, we have access to the similar compounds that can help to modify the system and help get us back into balance and give patients some relief, potential relief at times for different disease states without some of the heavy side effects or adverse effects that come from other products. So it's a new industry. I think I'm not afraid to be at the forefront of things or doing something new. May not feel safe at first, but as things catch up, more opportunities come. So see the recent executive action to reschedule cannabis, which is going to open up research, which I think will open up more opportunities for farmers in this space and more opportunities for clinicians to get into it. There already is and having medication on the market, right? Like different cannabidiol. The proof is there. There's history there. There's the anecdotal data there. But now we're getting to where we can get some more science behind it.
Wow, interesting. Thank you for sharing that. That's very detailed. I think there's some things. Thanks for joining Dr. Ronke Komolafe. That's my fellow Nigerian. That's Yoruba. Thank you for joining. If you're here, please tell us where you're coming from and where you're joining us from. Please put in the chat. And also, if you have questions for our guest, Dr. Charles, please put also in the chat. So now you give us very detailed cannabis regulation. It has changed over the years. It seems that there's going to be some addition and people are going to be able to make money from it. But something that always give me some concern is the fact that it's always like the natural medicine versus the mainstream medicine. I'm like, oh, which one is better? And it seems that if you want to go natural, uh, you're not going to use the drugs that are being produced and things like that. Uh, is this the true thing, or is just
I,
something that?
I think that's a perspective that we as people create, right? Like if we're trained in Western medicine and in the industries that we're trained in, clinically based medication, then uh, I think we understand this about the balance, right? Because if you think about natural medicine, right, food is medicine. So when you talk
Yes.
about nutrition and diet, technically, if you wanted to just focus on that and living a better, healthier lifestyle, that is you practicing natural medicine. If I were to oversimplify it, so it's like, how do we get the two to meet, right? How do we utilize knowledge on both sides? I think that's where when you're too much on one side, that's where you create these gaps of like, oh, I don't want to talk to a physician at all. It's like, why not? We have experts that understand the body, everything that's going on. We have pharmacists that understand medications, how they work, all these things. But then sometimes we have clinicians like, oh yeah, I don't believe in any of that, or I'm not trying to learn any of that. And you have patients that's still a part of how they want to take care of themselves. So we should do the due diligence of educating ourselves in these different modalities, these different treatment forms, right? So we can create like overall well-rounded treatment pathways for our patients, and create like true access to care.
Yeah, good, good. Thank you for sharing that. So you've achieved a lot. You do a lot. You represented something that we have to be able to tell ourselves the truth. It's not a lot of people that have been able to achieve and have a network and move things around the way you've moved things around. So we want to know what are the resources and opportunities that have supported your personal and professional success, so for you to be in this position whereby people are trying to learn from you.
I mean, well, it's community. Like your tight knit community with your family. So, like, of course, me and my wife has been a key aspect in like a lot of my success. My parents, my siblings, my sister, right? The friends that I've made that are family to me now as well, and then even the broader community with this network. My fraternity brothers, like Kappa Psi Pharmacy Fraternity, Alpha Fraternity Incorporated, my other fraternity that I'm in as well, right? That broader community, the Howard community, that network as well, and then the people I've met through the BHC network. There's so many people that I've met through BHC mixers, through this community that have been like, hey, I met somebody here that you need to meet. I know somebody at this company that might want to help you with this. I know there's this opportunity, right? Even you asking me to be on this podcast, right? This is how we help each other out. We collaborate, give each other opportunities, and yeah, share resources, share ideas, and that's how we all can grow and be successful. So I think that's just an important mantra of what how I want to live and how I want to move. And I think BHC as a network is a large example of that. Hopefully pushes that mindset into everybody that interacts with us.
Good, good. Thank you for sharing that. That's very powerful. That's something that I can relate to, and of course, I hope people are learning from the conversation that we're having. Thank you for joining, Erica Robertson. Thank you for joining. It's nice to hear from you. If you're here, please let us know where you're joining us from. Put that in the chat, and also if you have a question for our guest today, please let us know what your question is. So, I mean, I like to see things in different ways, right? We just saw one side of it. The opportunities are there. You seize the opportunity, because it's another thing for you to have opportunity right in front of you. It's a second thing to be able to, well, I'm going to seize this opportunity. You saw the opportunity, you seize the opportunity, you're making some difference and some impact on that. Now, let's go to the other side of it. Let's say for whatever reason, you were not able to get your family, and you were not able to start Black Health Connect and Paradigm. What would you be doing? What's the second best thing that you think you'll be doing? Would you be a boxer or what?
Funny. I don't know. Second best thing, I think the second best thing is kind of what I'm doing right now. For me, it was when I was in high school. It was either like science or media. I used to draw a lot. I was doing graphic design, computer design. So I think I've always enjoyed like being creative and marketing, and then applying those skill sets to other spaces. Maybe I'll be doing marketing in a different industry. Maybe I'll be doing marketing in healthcare still. Just not starting from the point of as a clinician, because the biggest thing my parents always told me is like whatever you do needs to help people. Because like making money is cool, but like how are you having an impact, and how are you giving back by building or creating the things that you're doing? And I think when you have that as like a north star, it's always gonna allow you to keep going. So probably be somewhere of a similar space, just different credentials behind it.
Wow, thank you for sharing that. I always think about that. Well, we have some opportunities. Not everybody will have the same opportunity in life. You just have to make the best use of the opportunity you have. So I just thought about that all of a sudden. Thank you for joining, Stephen. Nice to see you again. These are people that I've met in person, that I've connected through Black Health Connect, Young Black Farmer, and they're all here today. Thank you for joining, Stephen.
Yeah, I remember Stephen. I met Stephen. Wow, I think I met Stephen at a mixer in Philadelphia, and then I met him again in DC. Stephen's great, man.
Yeah. Thank you for joining, Stephen. Nice to have you. All right, so I know we have some success with bringing people together. You've been doing this. I'm part of your success story. There are other people like that, but then I can still see that there's still some people that are just hesitating to know whether they're safe or it's something that they should do to be part of a community. So based on the experience that you have, are there things that you're trying to try, or things that is coming to your mind as to ways to bring more people together? Maybe you can have higher numbers, because you have 30,000 members at BHC now. How do you intend to double the number you have?
That's a great question. Actually, it's a lot of what we're going to be focusing on this year. To date, we've touched a little bit over 45,000 now. People across the U.S., Africa, Europe, and how we're always thinking about other ways for us to reach them. I think a lot of that requires like slowing down in some areas to build up. So I would say just look out, follow us for what's coming next. But how do we provide information outside of the third spaces that we've created? How we're a bit more intentional about what we're posting on our social media platforms and our channels. And then also like how do we create more ways to highlight the amazing people within our network. Those are all things that are going to be priorities this year for us, so that we can reach more people and then pull them in person. They're comfortable once the time comes. So I'm excited to show everybody what's next, and excited to build towards it with the amazing team that we have.
Good. Thank you for sharing that. One thing that also came to my mind that's very close to that is networking. This is all about networking, and a big piece of networking is bringing people who are so knowledgeable, they have the resources, they can connect people to the resources they have, versus people that are just aspiring, they need help, they need a connection. So it's always a power dynamics, right? In terms of, I'm the vice president of this company, but then the other person, I'm aspiring person, I want to get to the farmer, things like that. So any suggestion on how to make the networking smooth?
I think we've been able to do that with the mixer. It's like a low barrier to entry. People from all levels are there. We have C-suite individuals in our network, all the way down to new grads. Most of our network are mid-career or advanced career, right? Managers, directors. But then we've also been intentional about creating spaces for some of the more senior folks so that they can find value amongst each other, and that way they're even more excited to come back to the larger event, right, and the mixer to connect with others. So that's something you'll see with our executive roundtable, which is more of like an invite-only space that we've been developing, bringing together CEOs, directors, VPs, C-suite individuals across the healthcare ecosystem. And then we also have the entrepreneurs, right? There are entrepreneurs who are like starting something new, but then there are entrepreneurs in our network who've raised millions of dollars, who are doing millions in revenue, and we've been creating spaces for them. So similar to Executive Roundtable, essentially an extension of that is like our Executive Roundtable Founders Circle, which is bringing those groups together. And those spaces have been extremely interesting because you'll find people who might be in different types of businesses, but might need the same tools and can share with one another. And those have been great. And again, because they get that value, they're able to come back and be in these larger spaces that we've been able to create. I also think I don't know if we're ever gonna exclude anybody. I think trying to be intentional about that either, in the sense of, for a lot of us to get to where we got to, we had to have met somebody that was ahead of us to help us get there. So I think there's people who are intentional about reaching back to pull forward, and being able to create that space that is across generations, across career paths, allows them to do so and find their community, right? Find their people that they want to help. Find your mentor. Find your business partner. That's our go-to. That's our slogan. That's why we say that. So find your community here at within BHC. That's our goal. We're building healthcare communities with the mixer, with the conference. And I think that's the best way of just showing up, and you'll find somebody that aligns with you.
Wow, thank you for sharing that. If you're here, please let us know that you're here. You can put where you're joining us from in the comment section. If you have questions for our guests there. Thank you for the compliment, Alicia Moore. Excellent podcast, and thank you for being here and giving us some feedback there. All right, so now that we've known that networking is very important, and you just said that you were part of that journey, at some point you had some support along the way. If you want to look back as to these communications and interaction you had with people, any advice that you can remember around career advancement, increasing diversity, or just improving health equity that you have along the way? Any conversation that you had that you can say, wow, that was a life-changing conversation that I had, or some nudges that you remember from anybody?
That's a good question. I think one of the conversations I've had is just around, it just shifted my mindset about how I show up in rooms. And I think how I like to push people to show up in spaces is like, one, just be yourself, but also always be willing to talk about where you're trying to go and what you're trying to do. I think some people call it like an abundance mindset of being able to share their ideas, not being afraid. I think sometimes people are afraid to say, well, this is where I want to go. This is the job I'm trying to get. This is the business I'm trying to build. And I think it's important to be willing and able to do that, because you never know who's around you that can help you or that has done what you've done. So that's like that one piece of knowledge that I think about. Like, you want to make sure you can find safe spaces, obviously, but also be willing to put yourself out there and share. Like, these are my goals. This is where I want to go to, because you never know. The person next to you might be the person that you're saying this is what they want to do, and they're looking to hire a person like that, right? Or they've done that already. They're just itching to find a person to share the information with. So that's what I want to get.
Wow. Thank you for sharing that. So alongside that, gaining network, there's AI, artificial intelligence. It's almost like if you have a conversation with anybody and you don't mention AI, they won't take you seriously in 2026. And there's this advert that say, well, everyone, if you want to be the most dangerous person in the room, learn about artificial intelligence. So my question is, based on the trend that you're seeing, aside artificial intelligence, which is, we're always going to talk about it through 2026. There's nothing we can do about that. Based on the trend that you're seeing outside that, any other thing that you're like, yeah, I think this is going to be the next thing that people are going to be talking about very soon, based on what is going on?
I don't know. I think AI is at the forefront of so many different things. How we realize it, how we can integrate it into our day to day, how we can leverage it to create, honestly, more accessible care. I think that's the thing. Is like, these tools exist. They're probably not going anywhere, right? It's like, how do we leverage them for the future that we want to see? I think that's the biggest thing. I think sometimes we are there's information put out there that make you afraid of like where things can go with certain things. But I think we all have the ability to manifest and all have the autonomy to like leverage these tools to build the futures that we really want to see. I think it's just focusing on that is what's going to be interesting. But right now, that's a big thing. Like it's getting integrated through healthcare. I think a lot we've built. There's been a major uptick in healthcare investment into artificial intelligence, implementation to EHRs, implementation to the tools that clinicians use. And hope results in just better patient care, right? The more tools for us, for the folks on the front line, we're working extremely hard, doing a million things, having like more efficient stuff. I think that obviously, cannabis with the being rescheduled, something else that more research put out there. I think more opportunities will come, more ideas, more facts around how it could positively have an impact on patient. I would speak to.
Wow, thank you for sharing that. Again, if you're here, please let us know you're here. Put in the chat where you're joining us from. If you have questions for our guest, please let us know. Something that really comes to my mind often is just saying, to elevate one's life, one has to elevate one's thinking. Is there any mindset shift that you've experienced along the way that you think, like, if I didn't have this mindset shift, I'm not going to be where I am today? Anyone that you want to share?
I think the biggest thing is being willing to go out and build what you don't see. I think that's the biggest one. What maybe build with the folks in my community, with our team, wouldn't exist if I wasn't willing to bet on myself and believe in it and keep going, even when the events were extremely small and the opportunities were really good. I think it's just having that level of faith that if you have an idea, you have a vision towards things, that there is a pathway to actualize that. Is the biggest paradigm shift for me that's had an impact.
Yeah, good. I have to go out there and try to chase something, even though you're not sure you're going to get it. Because I'm sure you didn't know you're going to have 30,000 people. It's like now, and it seems like it's growing. You said 45,000 and things like that. So yeah, if you didn't take that risk, you probably wouldn't be able to know what is possible, right?
Exactly.
Thank you for sharing that. So very close to that, I know you do something that is good. People are trying to associate with you and trying to learn, and you just got an invitation on the podcast just now. So I'm not even making this up. This is so somebody's like trying to collaborate with you. I'm trying to work with you. What are the things that you're looking for? What are the things that you're gonna check box such that they can work with you and you guys can work together?
I think for me, it's just like, is it truly collaborative? Are we having a positive impact on our community? And then for me, is it going to fit into the work and the mission that we're building here, right? With BHC, those are all the things that I'm open to when it comes to like collaboration opportunities. And that's how I make decisions on who we're willing to work with now. So that's why you'll see us. We'll work with any of the organizations that already exist. How do we help? How do we help grow membership? How do we help drive people here? How do we help highlight amazing work? Because all of that, as there are more eyes on the amazing work going on in the ecosystem, then the entire ecosystem gets better. So those are the things I'm looking for.
Wow, interesting. Thank you for sharing that. Again, if you're here, please let us know you're here. If you have questions for our guest, please put it in the chat. One of the things that I observed about you when I first met you is the way you dress. You're just very sharp, right? In the suit, right? Oh, very nice.
Shout out to Faydu and Gilbert. So yeah, I have a good friend of mine who owns a bespoke suiting company. He's my wedding tux, everything. He's made everything. His name is Ilbert Sanchez. His company is called Faydu, Fedu. But yeah, it's amazing. A designer out of New York City. So thank you.
That's good.
Thank him. Gotta thank him.
That's good. That's good. Yeah, that's a good link there. So my question around that: what is your philosophy about dressing, fitness, and presentation?
I mean, I think sometimes you can feel how you look. Like you can be in a bad mood, and when you get the right outfit on, and it elevates how you're feeling. Right, I'm being able to go into a space and feeling confident about how you're presenting in that space, about you being confident in spaces. Presentation is key. I think, especially for folks that come from the communities we come from, the backgrounds we come from, we're already being judged, unfortunately, from when we walk into a room from what people can see. So it's just never giving people, any type of opportunity to create like a seed of doubt, and hopefully be able to then create those spaces where that mindset is no longer needed, right? Because we've been able to elevate to that space and do so. But and then outside of that, you only get one body, so health is wealth. I'm working on resting and sleeping more and doing those things, but I think that's just another important mindset to keep of taking care of yourself, taking care of your body, even if you're striving towards something better. You gotta get those hours in, or you may not. You won't, if your body's not running the right way, you won't be able to get to where you want to get to. So, those are all things I'm working on maintaining.
Yeah, good. Yeah, thank you for sharing that. Thank you for sharing that. We still want to learn more about who you are outside what you do. So, one of the questions that I have is, what is a life lesson that you wish you learned earlier than this?
Oh, either way, it's gonna be hard. That's
Yeah,
either way, it's gonna be hard. You just gotta choose your heart. So I think, especially for a lot of us, we go to school, we get degrees, we're supposed to like do these jobs with these degrees. You may love the industry, like I love healthcare, I love giving back, I love helping people. Doesn't mean I love like the environment doesn't mean I love the environment that might have been created for pharmacists X, Y, and Z, right? So either way, you could stay in one area and just do that same job for forever and not love it, or you can create a pathway for yourself that might be difficult, that might be unknown, that might be hard at times. But I think either way, it's going to be hard. So you might as well enjoy it while it's hard versus not enjoying it and still being hard, right? So I think it's just like choose your heart. That applies to whatever decisions you make, of even like when it comes to health, when it comes to saving money, when it comes to any type of decisions you make. There's short term, easy decisions, and then there's the long term, it will be positive in the long term, but difficult in the short term. And yeah, just gotta choose your heart.
Wow, choose your heart. That's very important. Listen, another question that I have around that is your religion, spirituality, and culture. How has it shaped who you are and the way you interact with people?
Man, I think sorry, I just got a little bit distracted. I apologize. But yeah, so I think it's for me, it's do unto others as you would have done unto you, right?
Yeah,
Being within community, helping other people. That's how I was always raised. You know, I said it at the beginning because it's a very important thing for me. I'm of Haitian descent, first generation Haitian American.
yeah,
Parents came here in the '80s. We're a culture of like extremely hardworking people.
yeah,
All of us, we've had to work hard to overcome different barriers, different things. I think Haitians, revolutionary people as well. So always understanding what it's like to be at the forefront of change and making a difference and impact. Um, so all of that, I think, has made me comfortable doing the things that I've done and continue to do. And like I said, my parents, when I was growing up, were always asking me, whatever you do, how are you going to help people? Right? Whatever you're building, how's it going to help people? So I think that's always what I'm thinking about when I'm making decisions and I'm building what we're building.
good. I love that you said something about Asia, and this is a good time to say something about that. I'm actually married to Asia, and we've been married for 11 years. Today's our anniversary, actually. So I know a few things about Asian.
Happy anniversary, man.
Thank you. And my question is this: why do Asians put the whole pepper inside the inside the
Listen, we gotta make the food taste good, man. I like get beat up for this, but I think we have a student diaspora, man. So, and I'm sure you can attest to the cooking, the food, the culture around the food is amazing. But yeah, we're a very communal community. I think food is dining and people come together, right? Dinner is dining. And I think our food is great. It's like being amongst each other within community. So.
yeah, the Jojo and so yeah, all of it. All right. So now, is there anything you want to say to our audience to wrap the session up? Anything coming up? Anything you want to share with our audience?
No, just honestly, thank you for having me on the podcast. I hope some people, if they've been a part of the BHC community, continue to be a part of it, support us in where we're going. We're actively looking for new partnerships, new opportunities, working with organizations. So if you think like the contracts that we have within our team would benefit the organization, it would be great to work with you and talk through like our capabilities. But honestly, supporting in any kind of way just by following is great too. So we're on LinkedIn. We have a page, Black Health Connect. We have on Instagram, it's at Black Health Connect as well. If you want to connect, partnership at blackhealthconnect.com to connect with us. And yeah, I hope to see everybody at the next networking event, at the next executive roundtable, fireside chat. And just looking forward to continuing to grow this community and this network.
Good. Thank you for sharing that. Erica said, choose your heart. I like it. Yeah, because life is always going to be hard. You're going to have to feel the uncomfortable nature of life. So you just decide which way you want to go. Thank you for being here. I really appreciate it, Dr. Charles Duclas. I'm really excited that you were able to make out some time in your busy schedule to be here. I appreciate it. I'll stay connected. Thank you so much. Take care.
Bye. Bye, everybody.
All right.